Okay, so I'm doing chapter 2, current challenges, and right off the bat, the author questions in what context does public health operate in, and it covers pretty much most of the aspects of public health. However, it's like nearly impossible to do that, but it goes into depth about how public health focuses on particular groups, whether that be young people, old people, the individual, the environment, or social and economic circumstances. Uh, Specific issues that was discussed was smoking, like e-cigarettes, alcohol, and how there was alcohol prohibition laws enacted and how those didn't work out. It talks about mental health, swine and bird flu, the pandemic, talks about food and security safety, talks about vaccines, talks about screening, age discrimination, and medication as prevention, talks about AIDS and climate change. So basically, public health ultimately focuses on lifestyle and its modification, and that's what was described, highly emphasized on was lifestyle and how to modify it, and that's through health education. And another aspect that public health focuses on is the inequality of health and how it's like nationwide, it's so unequal depending on class and education and region and salary. There's 3 levels of public health and its workforce, and that includes specialists, practitioners, and the wider workforce. And that is the wider workforce could be journalists to pharmacists to social care services to teachers. It's basically anybody regarding with people and having the ability to modify one's behavior. It also discusses about the increase in populations, the increase in life expectancy, talks about the decline in fertility. Interestingly, it talks about obesity, and that's what I'm going to implement into my introduction is what the author is talking about is how obesity is increasing. And that's relevant to my research question because I'm talking about nutritionists and how they can be better prepared for entering into the workforce. And it turns out that behavior modification is a primary concern. In order to change behavior, you have to improve in communication. And the reason why we want to change behavior is because obviously there's an increase in obesity, which is the ultimate issue. So it's really relevant to my research topic. So that was pretty good that he talks about obesity and how it's increasing. He also talks about how there's an increase in antibiotic resistance. There's an increase in new infectious diseases, and just ultimately all of these factors make public health so difficult and broad. It's so broad to face all these challenges. So like public health operates on 3 different levels. That's globally, nationally, and locally. And the author also covers how public health changes over time, which makes it even more complex. It just makes public health have a really, really broad agenda. There's just so many priorities to focus on for public health, and that's essentially what the whole chapter covers, is just the aspects of what public health covers. It's just, it's nearly impossible to discuss every subject matter of public health, but the author tries to propose which areas public health can focus on. It's really no limit, essentially. It could be anything from socially to economically to mentally to physically, focus on aspects of the health. So it's just, health is broad as it is. Like, the definition of health is broad. So public health is going to be broad, and that's basically what the author argues. Okay.